So now we move into our keynote presentation and discussion, how the new healthcare impacts national security. Please welcome Janet Marchibroda, Executive Director and CEO of the Council on Health and Innovation, Bipartisan Policy Center, and Gregory Treverton, former Senior Fellow, Belfer Center for Science and International Affairs, and a member of the Council on Foreign Relations, and of course, Dr. Leslie Saxon. Let's welcome them.
Thank you. For life care to work and all of the issues we've talked about today, we need policy, and I think we also need, we keep hammering this cybersecurity issue, but it really travels through everything we're trying to do because it's digital. And there was, I understand, another breach today with Facebook. I first met Janet Marchibroda, who I'll ask to introduce herself. She runs health at the Bipartisan Policy Center in DC, and I met her because I was there with a group of people from Abbott talking about the recent FDA advisory on implanted devices for a potential exploit. There was nothing scarier to the public than a potential exploit of an implantable device. There was a software mitigation, and there was a lot of learning involved in that. And we heard from a lot of security experts, and I realized health and the protection of health data in the state is critical. And Greg, you worked. The other really interesting area of this is if we're creating these products in the United States, because you're a global government security expert, if we're creating these products and we're supporting these platforms, whether it's American companies, what does that look like for our place in it from a security perspective in the world? So I basically, Janet, I want you to kind of riff on this. You've both published very influential papers recently on global security and on health IT, and I just want to hear your thoughts because it's a really key area, how policy and government are thinking of this.
Does it just work? Leslie, it's great to be here and with all of you and to hear about all of the exciting innovations that are out there. I think it's a really important time in healthcare. I remember, the dot-com boom and all the cycles we've gone through around bringing technology to healthcare, and we weren't quite able to get there. And now I think we are. I don't know whether, a combination of things. The technology's better, but I think we've got a better environment in Washington, whereas, there are a lot of difficult things going on in Washington right now. But I think we've got a terrific environment to help entrepreneurs and innovators in digital health to really get to the other side and get these tools into the hands of patients and clinicians and payers.
So you testify before Congress. What are the kind of things they're asking you they need to act on? What are you telling them?
So, we've spent a lot of time, Leslie, thinking about these issues. When you think about it, digital health innovators, when we ask them, what are the challenges to making it? Of course, they say access to capital is the big, the number one barrier challenge for them. But the other thing, in addition to sort of understanding our crazy maze, which is healthcare around who pays and who uses and what happens, and it's pretty fragmented, a number of folks struggle with, well, how do I navigate regulatory approvals? And we've seen a lot of advancements in government. Bakul talked to us this morning, the 21st Century Cures Act. There's a lot of legislation and rules actually coming out this summer that'll make it easier for innovators to navigate regulatory issues. The other thing is around payment, and we've struggled, right? We've struggled, what's my business model and how am I going to get these things paid for, whether it's through the payer or the health system or the physician office or the individual. And I know we'll talk about this more, I don't want to go on too long, but a lot of exciting things are happening right now. We had some legislation that passed earlier this year that's going to help. Medicare will start paying for things that are health related, like we've talked about today, whether, hopefully rides, air conditioning, when you're in 100-degree heat, things that are not typical medical services, now we'll be able to see some payment there. And even in a physician payment rule, a draft is out. The comment period was due in September. We're seeing more payment through Medicare for telehealth. And then, of course, security and privacy, and I know we'll talk about that a little bit. So lots of good things happening. I'm very optimistic, using our definition around where we're going to go here.
Greg.
My immediate point of departure is I left the Obama administration on Inauguration Day. I'd been chairing something called the National Intelligence Council, which is the Director of National Intelligence's senior interagency body for intelligence analysis. I've been in and out of the government more times than should be allowed, mostly working on national security, and have always thought from the beginning that national security is a broad term. We can have theological debates about it, but it certainly encompasses health. We've had pushback when I was at the National Intelligence Council. Congress would sometimes say, why are you working on health? That's not classified, it's not secret. We would say because it's important. Indeed, my predecessors did a major paper in 2000 on global infectious diseases and implications for U.S. national security. So we can argue about whether attaching a security label to this is good or not, but I think in general, my view is if things are broadly important to the country, they qualify as security. Before I went into the government the last time, I was at the RAND Corporation chairing a Center on Global Risk and Security. My chair was Harold Brown, the former Secretary of Defense. We went through an exercise and asked ourselves, what threats to the United States out there are existential? What are nuisances? Or existential, serious, and nuisance, right? And then I think still, the only one in the existential category was a major pandemic. That's the only thing I can imagine out there that would dramatically change the nature of American life fairly quickly. So that was always top of the list. The other thing that's happened, obviously, is 9/11, and we've gotten terribly concerned about bioterrorism. So interesting question, happy question, why that dog hasn't exactly barked. Now, maybe it's the case that our adversaries like spectacular. They like killing people, but they perhaps like killing people at one time, not over time. But that is an interesting dog that hasn't barked. And in some sense, I think we still continue to pay attention to it. It means that all those conversations we said we ought to have during the Cold War between healthcare professionals and national security types now do happen. The final point for me, though, is what strikes me, and this takes us into the digital realm, is how interconnected all these things are. We try and handle discrete issues, but I was first struck by this. I was vice chair of the National Intelligence Council in the Clinton administration, so it shows you how slow a riser I am. But we did a paper then on HIV in Africa, and one of the things that we were looking at was what were the implications of that for military affairs in Africa, since at that time HIV/AIDS was especially affecting young men. Later it affected everybody, but bad effects then. So it reminded you that things are connected, that we can't just talk about health, we can't talk about water or food. They're all interconnected, and they depend a lot on infrastructure and on governance. I was struck, and here I'll end, Leslie, but I was looking at the numbers today, and it turns out that I guess this year, for the first time in history, most people have not died from parasites, viruses, and bacteria. So that's a great advance. The bad news is it seems mostly have been produced by technology and outside assistance, and hasn't been accompanied by the combination of infrastructure improvement and economic development. So we now have people who are healthier, but not any more likely to find jobs.
We talk about building this great humanitarian accomplishment of the life care support for the world, no matter anywhere, anytime, on demand. At the Bipartisan Policy Center, I heard Michael Morrell, the ex-CIA, say, "Oh, that's just a big attack surface for me." So is that how the CIA looks at it? You know, we're looking at it as creating this unprecedented access. Are we creating a big attack surface? Are we, are we going to weaponize the fact that if we end up supporting digital health for many in the world, can that be weaponized even by us against our enemies? Like, I've read your stuff in Global Threats, and you kind of talk about it a little bit.
Yeah, no, it is a great worry. I mean, that's the challenge. All these things are wonderful, but they do have that vulnerability side. But shortly before I left the National Intelligence Council, I was at dinner with some technologists, and a group of them wouldn't have a car made after 2007. Turns out 2007 is the break year. After 2007, cars were basically full of sensors and devices. And they were literally worried that somebody would hack into their car, lock them in, and demand ransom. So the threats are real, and we need to, I think we're probably not, in general as a country, conscious enough. And when I talk to private companies about cyber matters, they're usually pretty satisfied. They essentially say, well, we can take 5% losses and we're not going to scare our customers. That may be okay for them, but I worry across a whole society, particularly as we move into the Internet of Things, which a lot of the healthcare devices will be, that we may be underprotecting ourselves as a country, as a society.
Yeah, I don't, does that keep us from going there?
No.
Absolutely not.
Shouldn't.
I mean, it's very exciting what's happened, and I agree that cybersecurity is a threat. I think we could probably do more on the privacy and security front in Washington. There's been a lot of discussion about it. I'm not sure, I can, Leslie, just do a quick run through. There was legislation around how we should see collaboration on advancing cybersecurity at HHS. HHS did take some actions. Congress thinks it probably wasn't enough. There wasn't clarity. It's not clear who's coordinating what and what the different roles are and what are the actions the government might take. So I think we need to do more. I think we need to figure out how the health component fits with the rest. It's not clear. And on the privacy front, depending on who you are, they're talking about it's been a long time since HIPAA, and I know a lot of folks really don't want any changes to our privacy policies. I think many providers and health plans, those that are covered by HIPAA, would like things to stay the way they are, and they'd like everyone else to be subject to it, whether you're a technology company or others that are under data use agreements. But folks on both sides of the aisle, both in the Senate and the House, are now thinking, particularly in light of all of these announcements, maybe we do need a new privacy framework in our country, something that's more modern and takes into account, Leslie, this notion of life care and where data resides today. A lot has changed in the last 20 years.
There are a number of digital health companies, not the big tech companies, that are really, frankly, pissed at Facebook because there's some early California legislation in the escapades around the election in Cambridge, and there's some early California legislation around and that they think is going to adversely impact digital health companies, smart pills, things like that. And they're like, look, we don't just secure data. We're healthcare companies. Our connected healthcare is going to be more ethical than Facebook's prior model. Maybe they've changed it. How do we not over-legislate? You don't want a Cambridge Analytica for health, obviously. Can we trust those companies to do healthcare? Because many of them, their business model is about advert or whatever. Are they going to segregate that? Are digital health companies going to be put in the same bucket who are really trying to have deep medical expertise? It's complicated.
I can, so just building on our conversation in Washington when you were with us, something that we put forward was, and we do this in other industries and across all sorts of areas in healthcare, but maybe we need some collaboration, not only amongst the agencies in Washington, but also the public and the private sectors. And we've done a pretty good job around setting principles or rules of the road that can be followed while organizations sort of hold themselves out to take those actions. So I think that's one step. It's clearly not the only step.
I think we're at the beginning of a long period of groping through our way through all these issues. For me, the overriding principle is here we have an old paradigm for risk, which is you regulate and then insure. But we know that can't work in the cyber realm. The technology is going to move too fast. The regulations are going to be overtaken. So we have this urge on the one hand to regulate. We know it isn't likely to work and may be counterproductive. Then we have this huge overlap where all of this stuff we care about is a public interest, but it's all in private hands, the Facebooks and the Googles and their own business models. So we now see particularly the Facebooks and Googles caught in this, for me, terrible position, which they're not going to get out of for quite some time, where they can't say yet, we're publishers and take responsibility for what we do, but they're a long way from being able to hide behind We're just platforms with no responsibility for what we do. So I think this debate is going to, excuse me, go on for a long time, and it's certainly going to wash over healthcare as well.
And how do you think the rest of the world is looking at this, since most of these are American companies, and it's, how's that going to play out, do you think?
From my perspective, it may be one of the reasons why the Europeans have been faster off the mark with their general data protection regulations, because these are mostly American companies, maybe a little easier for them to regulate or try to regulate. But I think if you look out, there are kind of three models out there. One is ours, which says kind of let her rip, not much regulation. Mm-hmm. That's been the tradition, at least. There's the Europeans who say, well, we'd like to regulate the cyber realm. We're not quite sure we can or how to, but they've done pretty well with the GDPR, at least a start. That may not work out, but it's a statement of intent. And then we have the Chinese, who basically say, we're going to regulate just like we regulate everything else. So in the midst of all this, we have these kind of competing visions for the future of the web and cyber out there. And I suppose it's no surprise that the Europeans have been a little more eager to regulate, since these are not primarily their companies, but have big operations in all of the European countries.
We pulled together earlier this year about 50 stakeholders, physician groups, medical societies, payers, providers, and we worked, spent some time with government as well. And when I think this model may apply to what you're talking about, Leslie, around what's the appropriate role of government, and maybe we could apply this to the security realm. One of the things we said is, a minimum set of standards, only the level of standards that are necessary, technology neutral. So, and we're seeing that with HIPAA a little bit. So technology neutral, because you can't predict what's going to happen in the future. Flexibility, risk-based, something that's stable and predictable. I'm thinking ahead as Congress and the administration think through some of these policies, so some predictability and stability, and something that infuses learning, having cycles, because what we know today is going to be different from where we're going tomorrow.
Great.
Let's thank Janet Marchibroda and Gregory Treverton for a wonderful
Great.
discussion.
Thanks. Thank you so much.